I'm Dr. Doris Day, and today I'm addressing the effect of stress for Stress Awareness Month, but I really want to focus on the effect of stress on the body, especially the hair. So 2 years ago, I shared on JCAT TV that the single most popular visit I've had for hair loss has been associated with COVID. And this is patients coming in with bags of hair, they're experiencing clumps of hair falling out, and they look for things that happened yesterday as to why their hair is falling out today. But one of the things I explain to them is that there's a lag and that the stress factor takes months to show and can last for months. So we understand that the release of cortisol can induce catagen and follicle regression, which leads to premature shift in the hair growth cycle. That's why we see so many patients with telogen effluvium 3 to 4 months later. Of course, I have to explain this in layman's terms to my patients, but it is important to understand the underlying process. And then over time, stress can also disrupt hormones, increase nutrient deficiencies that are needed for hair growth. So we need to balance out stress for many reasons. It can cause both a telogen effluvium, but also it can affect androgenetic alopecia and even autoimmune alopecia. So when I address hair loss in my practice, I try to understand the patient's history and their life events over the past 6 to 9 months, even a year, to try to understand, or longer, to understand what is driving this hair loss. And then I typically try to recommend things they can do at home. I start with Nutrafol because this is a nutraceutical that has great data that helps address hair thinning caused by stress or other numerous root causes of hair thinning, including the nutrient deficiencies, metabolism, aging, and hormonal imbalances. One of my favorite ingredients that they have is the Sensoril ashwagandha, which is a medical grade clinically proven stress adaptogen that's known to help the body build stress resilience, and that supports a healthy hair growth cycle. It also helps them systematically address the stress they're experiencing. So I feel confident offering this along with other topicals and even in-office treatments as needed. And I really love that they continue to do their clinical research and build on what they have. Thank you.